There is a huge amount of research emerging that is looking at the impact of food on our health. And what we know is that eating real food has an impact on our health, but yet at the same time we know that the majority of calories that are consumed in our country are consumed in the form of processed food. And formula, what we tend to feed infants in our country, is the very first processed food that human beings receive in our culture. Breastfeeding is really all about babies eating real food, eating food that's very close to the food chain. It's food that their digestive system was meant to take in and keep them as healthy as possible. On the other hand, another body of research that's really emerging is about the breastfeeding process. What does the breastfeeding process do for babies? And we know that there is an integral part of the breastfeeding process that helps a baby's brain to grow and develop. It helps babies feel very safe and comfortable, and it really helps them kind of tackle the world. But when it comes to breastfeeding, we're not a breastfeeding country. The majority of babies in this country are not breastfed exclusively for 6 months, which is the recommendation by all the public health and medical experts. Because what's really happened is we've created a culture where moms really don't have the support or the environment in which they feel comfortable breastfeeding. Whether it's because we don't have good medical leave policy for new mothers, they're returning to work, they don't see other moms breastfeeding. Think about how we learn things in our culture. We learn because we see it and we practice it. Well, how do you see breastfeeding and how do you practice it when nobody's breastfeeding? So all of these things kind of come together and create an environment that's hard for moms. Then you take the mom who's new to America, or she's someone who didn't grow up in America. She has a different language. She has different cultural customs. If she's low income, we're giving her free formula. And then we say, oh, and by the way, breastfeed your baby because it's good for your baby. So one of the reasons that we sought funding for this community breastfeeding educator project is because at Milkworks, which is a community breastfeeding center, we do a little bit about everything directed to at providing services for breastfeeding moms. What we realized is that we weren't reaching certain moms very well. We weren't reaching moms that maybe had a cultural or a language barrier, and they were maybe uncomfortable coming to us. They were maybe uncomfortable having transportation getting to us. Would they have an interpreter? Would they be able to understand us? And breastfeeding support looks pretty white, not just in Lincoln, Nebraska, but across the country. And there's a big push nationally to try and make breastfeeding support more diverse, so that moms, no matter what their language, no matter what their culture, their customs, realize that there is somebody out there that understands breastfeeding, knows a little bit about breastfeeding, and can help kind of guide them through. Particularly if their family is not around, their mothers, their aunties, their grandma, their sisters. They have some other women that they can turn to that look like them and talk like them and understand them, that can help them through this process. The community breastfeeding educators are this group of absolutely dynamite women. They all come from different countries, from different origins. They are passionate about breastfeeding. They are passionate about women and about babies and about families, and we are so excited to have them on board. I have learned a tremendous amount from them, a tremendous amount about what breastfeeding looks like around the world, and we're just really excited to be able to offer them to the community.